We go over the specific fears because usually there's something. There's usually, I had a lot of pain, or I didn't know that this was going to be involved, or usually there are one or two big level stressors. So with this patient, who it's interesting working with children who are still adults. So that was the interesting. The first time he had the procedure, he was a child. He was 16. Now he's a young adult in college, and didn't want mom involved, and I'm like, "Hey, I'm not going to get in the middle of that. I'm just going to work with you and your mindset and what you want to focus on." So we talked about it. We talked about pain management. We talked about things that can help with pain management. We worked with his doctor in terms of things that they wanted him to do or not do. I mean, there were some things that they wanted to alter about his caffeine intake. He was not taking any type of pain medications before. He really did not have a good experience with the particular narcotics he used last time. So we talked about that. I told him a little bit about managing his pain so that he never got to a level that pain was just totally out of control. And also about communicating clearly with the surgeon. I said, they don't read your mind. If you're having a problem, you need to call in. But these are some of the things that you can do to help manage your pain better. And we got on a schedule because caffeine actually can be useful in certain instances to help with pain management. So we got on a consensus about how we would manage the pain, both before surgery and after surgery. Um, After surgery, when he was able to talk, we talked a little bit. We texted a lot because it was craniofacial surgery. So I was able to coach him, help him with problems that he was having with pain afterwards. Um, I did find out that it was a much different experience this time because a lot of things that he knew before, the pain management helped. Like the caffeine. He used caffeine in moderate amounts to help reduce the amount of narcotic that he needed. And because this time he knew a little bit more about the procedure and what he could expect, he had a much better experience after the second one. So it was a matter of working with mindset and getting him to envision, okay, we're going to be pain free. This is what we're going to work on as far as breath work. When I am having pain, these are the procedures that I'm going to go through. This is how I'm going to manage my narcotic medication. This is how I'm going to manage my non-narcotic medication. If I'm having an issue, I'm going to call my doc sooner rather than later. And we're going to be really clear about side effects. And we did go through all of the medications that he was going to have. So I was able to say, okay, this medication, this is the side effect that you need to look at and or look for. And if you start having this side effect, there's another medication that you can get. Contact your doc. So I wasn't as much, I didn't see myself as interfering with what was going on with the doctor patient relationship as much as I did coaching him. This is what you need to do. You need to be proactive about calling your doc. You need to do the breath work. You need to, as soon as you're able and cleared to get up and get out and start walking, you need to start doing that because we want you to continue to progress with your recovery period. And part of that is staying active, doing the rehab, doing the exercises that the surgeon is going to have you do.
So have you, literally you're not working as an anesthesiologist right now, or you're just working per
Per diem.
diem? Per
Per
diem.
diem,
Okay.
yeah, just per diem. I do some remote work as well. There's a lot of work opportunities to work with companies that are doing remote AI models, and a lot of I've got jobs that are out there with that. But yeah, it's a challenge, but I tried to do it, as I mentioned, part time, and just the amount of energy and time I was having to do getting up at 3 and 4 o'clock in the morning as an anesthesiologist. trying to run a business that is different from being in OR anesthesiologist, it just was not meshing. So this is a big step.